Picture this. You're at the doctor's office for something simple like a checkup. A few weeks later, you get a bill, and suddenly you're asking questions like, what's a deductible? And why do I owe $200? If you've ever felt like navigating health insurance is harder than passing a calculus exam, you're not alone. It's confusing, messy, and let's be honest, designed that way. Let's unravel the twisted tale of why health insurance in the US feels like it was written by a trickster god. Welcome to Unusual Perusal, where we dive into history's quirkiest moments and modern mysteries that make you go, for real? Today, we're tackling a beast, the baffling tangled web of health insurance in the United States. Why is it so confusing? Who's making it this way? And how did we get here? Let's dig in. It all started in the early 20th century when healthcare was simple. You went to the doctor, paid a few bucks, and then went on your merry way. But as medical care got more advanced, it also got more expensive. Enter health insurance. The first major plan, Blue Cross, popped up in the 1920s to help cover hospital costs. And at first, it wasn't too bad. You paid a small monthly fee and they covered the big stuff. Sounds straightforward, right? Oh, just wait. During World War II, the government put a cap on wages to control inflation. But companies still wanted to attract workers, so they started offering benefits like health insurance. Suddenly, your job wasn't just where you worked, it was how you stayed healthy. And this system stuck around because, hey, it seemed to work. But tying health insurance to your job was like building a house of cards. It looked stable, but one strong gust, well, we'll get to that. Now here's where it gets truly unusual. As healthcare advanced, insurance plans got more complex. Companies introduced deductibles, copays, premiums, out-of-network charges, and my personal favorite, the explanation of benefits that explains nothing. Why? Because every player in the system, insurers, hospitals, drug companies, started jockeying for profits. And you're stuck in the middle, trying to figure out why your flu shot costs $40 in one clinic and it's free at another. It's like they designed this whole thing to be confusing on purpose. Oh wait, they did. And while all this was happening, healthcare costs in the US started climbing like it was training for Everest. Why? A mix of expensive medical technology, high drug prices, and a system that rewards hospitals for charging more. And who pays for it? You, with premiums that eat into your paycheck and surprise bills that make you question if you even want to be healthy anymore. But the real kicker, employer-based insurance. If you have a job, great, you've got coverage. But lose that job, suddenly you're on your own, navigating the nightmare of private insurance or government options like Cobra, which sounds more like a villain from a comic book than a healthcare plan. This system locks people into jobs they hate just to keep their insurance. And if that sounds backwards, congratulations, you're paying attention. So why is it like this? Short answer, money. Long answer, profit-driven systems don't thrive on simplicity. If everything was clear and transparent, you might start asking uncomfortable questions, like, why does my MRI cost $2,000? Or, why can't we just simplify all this? And trust me, the people making billions off this confusion do not want you asking those questions. Every few years, someone tries to fix it. Healthcare, the Affordable Care Act, calls for universal healthcare. These are all attempts to untangle the mess. But every solution runs into the same problem. The system is so deeply entrenched, changing it is like trying to rewrite the rules of Monopoly in the middle of a game. That doesn't mean it's impossible, but it does mean the fight is far from over. And there you have it, the baffling, infuriating world of health insurance in the US. It's complicated, expensive, and more confusing than it has any right to be. But understanding how it got this way, that's the first step to figuring out how it might change. If you enjoyed this deep dive into the strange and frustrating, hit that like button, subscribe, and join us next time for more stories that'll make you say, for real? Until then, stay curious, stay bold, and always keep perusing the unusual.